And to understand more about this program, we're joined now by Laura Thomas, Director of Harm Reduction Policy for the San Francisco AIDS Foundation. Thank you for being here with us, Laura.
Sure, thank you.
Laura, in 2022, California became the first state in the country to receive federal approval for what is known as a contingency management program. But the San Francisco AIDS Foundation was implementing this program well before that. Speak to us about that.
Sure. So San Francisco started providing contingency management over 20 years ago in the context of HIV prevention, recognizing the role that meth and stimulant use had as a driver of the HIV epidemic. And the San Francisco AIDS Foundation has been proud to provide these services and have been able to expand them over the years to serve even more people.
How does the program actually work?
Sure. So people in our program, which we call PROP, and in our Stonewall project in San Francisco AIDS Foundation, people come in if they decide to enroll in it. They come in 3 times a week. They provide a urine sample for a tox screen, and if that is negative, then they receive an incentive. In our program, people can choose what kind of gift cards they want. So if they want them at Target or somewhere else, they can also get them intermittently during the program, or they can save them up until the end. Our program is a 12-week program. The maximum amount that people can earn is a little over $300. So it's not a huge
Nice.
amount of money, but it's enough to really make a difference in someone's life.
And based on that data and the psychology part of this, why is it that offering a gift card or any other incentive helps addicts stay clean?
I think it's basic human nature and human behavior. There's been extensive research behind this that demonstrates that when you give people positive reinforcements, that enables all of us to make better behavior change. And you can see that in things like employers giving their employees incentives to work out or to lose weight, or in other contexts, incentives to get people to come in for healthcare or for screening tests has been really effective at getting people to change their behavior. I think, for all of us, whether we're trying to quit smoking or lose weight or whatever it is, when we get positive reinforcement for that, it's easier for us to make the behavior change. So this is the same thing, but on a more organized scale in these specific programs. But I'm very unsurprised that Marin is having as much success in their program that matches the success that we've seen.
So when would you say is that key spot of when you guys are noticing this behavior change?
I mean, our programs are they're very self-directed. So people identify what it is what is the change that they want to make in their substance use, in their behavior. And so they help determine what their goals are. We work with them to help achieve those goals. We provide support groups. We provide one-on-one counseling. We provide wraparound. We'll help people if somebody wants to access a different kind of treatment, if they want to access some kind of healthcare services, we help them with all of that. So it's not just the incentive, that's the core of the program. But we see the changes in people pretty quickly in terms of people coming back over and over again, and really being able to make progress in changing their behavior.
San Francisco, as you know, is facing a drug epidemic, and in 2024,
Yes.
health officials said the city was expanding this program.
Yeah.
The funding was $2 million last year. Have you seen an increase in enrollment here?
Yes, absolutely. So we've been able to expand our program. So initially, our program was only for gay, bi, and trans men who are using meth. We've been able to expand that to anyone who wants to be a part of this program. And I think it's really important, as you said. We're seeing this huge overdose crisis in San Francisco. It's really important to be able to connect people to treatment and be able to provide people with treatment when they want it. That's a core part of how we address the overdose crisis. And we just as an organization, we believe that people should have access to healthcare services when they need them. So that's part of the contingency management expansion has been really great to see, and the city's been able to expand it to other organizations. And so we're now no longer the only organization providing these services in San Francisco, but multiple other places are as well.
What are some of the drug addictions this strategy is helping tackle? And does it actually work better with some more than others?
It works for any substance use. The one of the reasons why we focus on contingency management for methamphetamine or other stimulant use disorder is because when it comes to opioid use disorder or alcohol use disorder, for example, we have medications that we can use, extremely effective medications that really help treat the substance use disorder. And we don't have anything equivalent for stimulants for methamphetamine.
Okay.
So, in the absence of a medication that we can use to treat it, this is really contingency management is really the gold standard for treating this.
Thank you, Laura. I appreciate your time here with us today.
You're very welcome. Thanks for covering this.
Absolutely.